I decided to pursue the role of a primary care pharmacy technician because I've been in pharmacy for 23 years. 21 years of that was in an actual pharmacy setting. And even though I felt like I made a difference doing that, I wanted to do more. I wanted to expand my role. I wanted to be more involved in direct patient care. Oh, there's a lot of favorite parts. I love helping people. I love being able to get people things that they otherwise couldn't get. We have an underserved population here at the clinic, and our folks are so appreciative when you do anything for them. So when you tell them, hey, I got your medication approved, or your medication's going to be coming in the mail for free for a year, it's unreal, the gratitude. I've gotten cards. I've gotten flowers, I've gotten all kinds of things, and just thank yous, hugs, just from folks, from family members, from patients, thanks for helping me, thanks for taking the time, thanks for caring about me. It's humbling, because you don't realize how many people need help that don't get it, and that medication they need that to live, and being able to help them get that is just my goal. I don't like to take no for an answer from insurance, but sometimes I have to, but we try to do other things. And probably another one of the favorite things that I love is working with this team of people here, because they are fantastic. Some of the most caring, compassionate people that I've ever met. And I mean, our patients are lucky to have this team of people that do what they do every day. I think expanding the pharmacy technician role is a great thing. Like I said, I've been doing it a long time, and there's only so far you can go inside the pharmacy. And a lot of people don't think pharmacy technicians do anything but, count the pills all day on the tray. But it's a lot, and it's such a rewarding job, and expanding that role, it makes people able to do more, to help others and to help themselves, and just to, because, like I said, you used to just be able to count pills. That's all you could do. So I'm thankful for this job. I love this job. I encourage every pharmacy technician to apply for one of these jobs if they ever get the chance. I've had to develop a trust with the providers, which it's nice when they come to you and ask you a question that they don't know, because you're just kind of like, okay, yeah, awesome. But it takes a little bit to build that trust. They will ask me questions. Instead of sending everything to the pharmacist, I'm able to take a load off the pharmacist as well as the nursing staff, different people that had to do this job before me. And medication access is the biggest thing, prior authorizations, but also just, finding out what's on formulary so I can let the physician know so they can prescribe that so there's no holdup at the pharmacy. Calling pharmacies to make sure people have picked up things, and if they haven't, find out why they haven't. Adherence, those things. All of these things tie into better patient care, which is better patient outcomes, which is that's what our goal is. It's just, healthier people, healthier patients, longer lives, and being a part of that is a blessing for me. I love it. I do.
Pam, our pharmacy technician here at ETSU Family Medicine, help all of us residents in many ways. Medication access is not something that we learn in medical school, but is very valuable. So having someone look over all of our orders and do our prior auths and those sorts of things helps us get our patients, especially in a rural area like Johnson City, their medications is invaluable to me.
So our pharmacy team at ETSU Family Medicine has always been the PharmDs, so ambulatory care, PGY2 trained ambulatory care pharmacists. So we are clinical pharmacists that are embedded into the clinics. We spend the majority of our time here taking care of patients, educating students and residents, both medical and pharmacy, and just being a part of the faculty here at each of the clinics. So ETSU Family Medicine was one of the early adopters in our region of having ambulatory care clinical pharmacists. It's been within the past 2 to 3 years that we have added in this new role on our pharmacy team to include pharmacy technicians that are taking care of things like prior authorizations and patient assistance, lots of calls to and from pharmacies and patients, and then certainly working very closely with the pharmacists at each of the sites too. So we now have a pharmacist and a technician at each of our clinics working with our team. So the history behind us adding pharmacy technicians in primary care really started a few years ago when we had an opportunity in our department to hire a pharmacy technician. I asked our department chair if we could utilize, kind of on a trial basis, some funding that we had to trial having a medication access expert on our team. Knowing that was a portion of my job, but if we had someone who was the expert at it and doing it all the time, that we would be able to provide better care. What we found is very quickly that temporary title fell off and it just became primary care pharmacy technician. And so we went from one technician to two, and now we have three primary care pharmacy technicians at ETSU Health. And I don't see us going in the other direction anytime soon. The benefits of adding our pharmacy technicians, I knew that we would see a benefit and we would see an improved patient experience, an improved provider experience, and that they're not having to try to deal with a lot of the kind of more technical tasks, an improved experience for our nurses, decrease in phone calls, all of those things. I still think I underestimated to some extent just how valuable they have become as a part of our team. And so it's not only having them for the role, but they're now also just a very integrated part of the team that is patient facing in a lot of ways too. And so our patients sometimes know Pam better than they know me or other members of our team, because Pam is the one who helped me get my medicine. And so there's sometimes a lot of fear, I think, from everybody in the current environment in healthcare of I don't know how much something's going to cost when I get to the pharmacy. And she is really able to do something about that in a lot of ways. And sometimes there's not something we can do about it, but having that person that says, I have exhausted every option, and let me tell you about all the things we've tried. Now I'm going to have the physician and the pharmacist step back in and figure out what is our next step, since this other medication is not affordable and is not an option. But the patients know that we have done everything that we could as a team, and we wouldn't be able to do that without our technicians.